Hello, we're back. And in this second video lecture, we're going to be getting more into the weeds about ICD-10 PCS, and we'll be covering the different sections, the different characters, and introducing you to some of the guidelines in ICD-10 PCS. Okay, so a little bit more about the medical surgical section. The second character is the body system. The human body is split into 31 different systems, and some customary body systems have multiple body system values. And a common one is the circulatory and musculoskeletal systems have multiple values. And you can see the values through here. I'm not going to read them, they'll be obvious in the code book. The third character is the root operations. This gets a little bit complicated. The best way to think about a root operation is think about what the objective of the procedure is, right? So if you're removing an entire body part versus taking out part of it is the difference between a resection and an excision. So there are 9 groups of these root. There are 31 root operations, and they're grouped into 9 groups, as you can see here. The fourth character is the body part. This represents a specific part of the body system that the surgery is performed on. This may specify laterality. So we could have a left foot or a right foot. And then fifth character is the approach. Like root operations, this is a common stumbling block for people that are new to the PCS system until you think about it, and then it will make perfect sense. We could do an open appendectomy, or we could do it endoscopically, right? So those are the types of things we're talking about with approaches. Could be open, percutaneous, endoscopic, and so on. Sixth character is the device. This is a device that remains after the procedure is completed. It's not something like a scalpel or a retractor or something, right? It's something that remains in after the procedure is done. And we have 4 general types. It could be biological, synthetic, biological, or synthetic that assists or prevents a physiological function, and so on. And the seventh character is a qualifier. And this is an additional attribute. So, for example, with the coronary artery bypass procedure, you're going to want to know what vessels were bypassed. And we'll get more into that later in the course. With PCS, each component of a procedure is defined separately. So the result is we get much more granular data. And the coder analyzes the operative report to identify the objective of the procedure. The procedure that is coded is what is actually done. If an intended procedure is changed or discontinued, the root operation is based on the actual procedure that was performed, and this is in the guidelines. If multiple procedures are performed, they're defined by distinct objectives, very important here, during a single operative episode, then multiple procedure codes are used. So an example of this, we obtain a saphenous vein graft for coronary artery bypass surgery. That is a separate procedure from the bypass itself. So you have 2 procedures with coronary artery bypass surgery. And again, multiple procedures are coded, and this is again per the guidelines. If the same operative or same root operation is performed on different body parts that have distinct body part values in ICD-10 PCS. So if we have a biopsy and a diagnostic excision on the duodenum and the rectum, those are 2 procedures. And again, another example along the same lines, we have the same root operation that's repeated on different body sites that are included in the same body part values. So we do a biopsy On neck muscles, the neck muscle is a body part, two different muscles, multiple procedures. And if we have distinctive procedures with multiple root operations, like we do a biopsy of the pancreas and a partial pancreatectomy, those again are multiple procedures. If we would have multiple procedures if the intended procedure cannot be accomplished and is converted to a different approach. So if we had a laparoscopic nephrectomy that was attempted and then we had to change to an open nephrectomy, the laparoscopic port of the procedure is coded as an inspection and the open procedure is coded as an open resection for the nephrectomy. If a procedure is a complete or partial redo of a previous procedure, that the root operation that identifies the redo procedure performed is coded, not the root operation of the revision. Whoops. And for the body part, the value chosen is the specific body part from the second character that the surgery was performed on. And again, we may also have laterality. ICD-10 PCS does not have a specific value for every body part. So in those cases, the body part that's selected would either be the entire whole body part or the body part value of the closest proximal branch. So when we're talking about nerves or blood vessels, this comes into play. And again, the coder should always look up the body part named in the alphabetic index to identify the value for the specific anatomical site. And again, here's an example. There's an entry for adductor hallucis muscle in the index that refers the coder to use muscle, foot, and then in parentheses, left or right. The approach is the technique that's used to reach the site of the procedure. So there's 7 different approaches, and this can get confusing. So please pay special attention to this. The 7 approaches are open, percutaneous, percutaneous endoscopic, via natural or artificial opening, via natural or artificial opening, endoscopic, via natural or artificial opening, endoscopic with percutaneous endoscopic assistance, and external. Let's take a look at what these all mean. You may want to refer to table 3.8, gives you a really nice breakdown of this in your textbook about what open is, percutaneous, and so on. I'll let you review that table on your own. And you may also want to take a look at figures 3.2 through 3.7 in the chapter of examples of these procedures. Sometimes it's easier to get the idea of approaches if you can actually think about it in terms of a real procedure. So you'll see some examples of open versus percutaneous endoscopic, percutaneous approach, approach via natural or artificial opening, approach via natural or artificial opening, endoscopic. And again, when we talk about the approaches, we're talking about 3 components: the access location, the method, and the type of instrumentation. Access specifies the external site through which the internal organ is reached, whether it's through the skin or incised, punctured, open or percutaneous, through an orifice, and so on. Method is how the access location is entered. So open means that we're cutting through the skin or mucous membrane or other body layers, and this may include instrumentation through a puncture or minor incision. Instrumentation is a specialized equipment used to perform a procedure on an internal body part. It may or may not be used to visualize the procedure site. Endoscopic is a term used in approach values when instrumentation permits a procedure site to be visualized. External approach is used when a procedure is performed directly on the skin or mucous membrane. And this may be performed indirectly by application of external force. And we'll see some examples of this later in the course. The sixth character, whoops, the sixth character talks about devices, and there are four general types. We can have simpler mechanical appliances like a trach, a vasculograph. We can have electronic devices, pacemakers, defibrillators, neurostimulators, all these different types of things. And if the objective of the procedure is to put in a device, then it changes what the root operation will be. It's an insertion. If a device is put in to meet an objective other than insertion, the root operation, defining the underlying objective is used. So in other words, if a procedure is performed to replace a joint with the synthetic device, it's a replacement. We're replacing the knee or the hip, what have you. Materials incidental to a procedure, such as clips, sutures, are not specified in the device characters. Specific device entries are included in the index to allow the coder to identify the device value. So if we see a term like a Kirschner wire is used for an external fixation device as the device value. So again, this is another example of how having a medical dictionary handy is super, super helpful. A couple more slides here and we'll stop. And the following root operations always involve the use of devices when coded. Anytime you see a change, insertion, removal, replacement, revision, or supplement, we're going to have a device. And that's all I have for you. Come back for a last video lecture on the introduction to ICD-10 PCS. That's all I have for you. Thanks for watching, and we'll see you online. Bye now.